Leukemia in childhood age group is usually a highly curable disease. In the best of standards in Western countries or in developed countries, the cure rate of leukemia reaches up to around 90 to 95%. That is 100 children, if they are treated for leukemia, almost 90 to 95% of them are completely cured of the disease. In India, even though we are not able to reach that standards, the child receives the right treatment from the right place and completes the treatment as per schedule. We get a success rate of around 70 to 75% in general. The treatment of leukemia is a little bit complicated, and as such it has its own set of complications also. The common complications associated with treatment of leukemia is mainly related to the decrease in the blood counts. This includes the decrease in the blood WBCs, platelets and RBC counts. When the WBC comes down, the patient can have serious and life-threatening infections. When the platelet comes down, they can have bleeding manifestations, and when the hemoglobin or RBC comes down, they will have tiredness, weakness. All these things can be easily managed with supporting antibiotics, supporting injections and transfusions of blood products. There are some rare complications apart from this, which can affect the intestines, or it can affect the pancreas, or it can rarely affect the heart or the brain and a few other organs as well. But these are rare, and most of these complications are manageable, and after managing all these complications, that's how we reach a successful treatment of leukemia. The treatment of leukemia is a bit complicated, as we mentioned earlier, and unfortunately we do not have many centers at the easy reach of most of the patients. So many of the times the patients and their parents or caretakers will have to travel to nearby cities or faraway cities to get and complete the treatment. They might need to stay in these faraway cities to complete the treatment. In this situation, this can affect the income of the family and the job of the parents also. This is one challenge that we face when we want to complete the treatment of the child. Another situation is related to the child's education, friend groups and psychosocial supports. We know that children at this age, most of them are only interested in having a good friend circle and playing around. And today in most of the good pediatric cancer treatment center, we also look into these concerns, and we arrange for facilities for finances to support the parents, as well as play areas and peer group to support the psychosocial and emotional concerns of the patients. After successfully completing the complicated treatment for leukemia, all the patients or most of the patients can lead a perfectly normal life, just like what their friends of the same age group can. They can pursue their education, they can go for whatever career they wish to, and they can pursue whatever future relationships wish to. Very rarely only we come across long-term complications after treatment of leukemias. These could include a very rare chance of a second cancer developing, or cardiac issues, or very rarely some brain-related issues also. Most of these problems are easily controllable, and we are still able to offer them very normal life for their future.